So this topic, SIDS, is one that, understandably so, we don't really want to think about, because it really is the biggest fear for most parents, that our child would pass away. So SIDS, sudden infant death syndrome, is typically when a baby under 1 year of age passes away, usually in their sleep, for seemingly unknown reasons. There's a few things that can increase the chances of SIDS. Brain defects, premature babies that have like a really low birth weight, that can increase their chances, or having some kind of respiratory infection. The baby had a cold or whatnot, that could increase the chances, which does not mean you need to freak out if your baby has a cold, but it's just something to be aware of, because usually with SIDS it does have something to do with the breathing, and they just stop breathing. And so the purpose of this video is not to have you live in fear and freak out, but to just give you a few simple things that you can do to lower the chances of this tragedy happening. So first and foremost, it is crucial to have babies always lay on their backs when you're putting them down to sleep. When they're on their side or their stomach, their airways can become blocked, and that can greatly increase the chances for SIDS. So always, always, always have them lay on their back. If you have a babysitter, a family member, somebody else that will be watching the baby, it is crucial that you drill into them the fact that baby is only to be put to bed on their back. And second, you want to make sure that wherever they're put down to sleep is free of any like soft, fluffy things that could get around their face. So ideally they're in a crib with a firm mattress and a fitted sheet, and no blankets to keep them warm. You can have a little sleep sack, which is a great option, or the swaddle, but no stuffed animals, no blankets, no pillows, nothing in the crib but baby and that fitted sheet. Breastfeeding has also been proven to reduce a baby's chances of SIDS. So breastfeeding for at least the first 6 months of life can make a huge difference. Overheating can also be a cause of SIDS. So again, you don't want to have too many blankets on baby, or even like having a hat on them to sleep. I mean, if it's a little light cap, it's not the end of the world, but you want to make sure that they don't get too hot. It's best to have them like a tiny bit too cold than too hot. And typically with your thermostat, having it on around 68 or so should create a pretty good temperature. And you can tell in the house, if you're really hot, baby's probably really hot too. If you're freezing, they might be a little bit cold too. And they typically don't need many more layers than you do. So again, when you're putting them to bed, have them in a sleep sack instead of like big heavy blankets that again could come up into their face. And so the next part I'm going to talk about is very controversial. And I am in no way giving advice or recommending this, but I'm just discussing this issue. So most websites that you go on, or many resources about SIDS, say that babies should never sleep with the parents in bed because of fear of suffocation. But many cultures that practice bed sharing with babies, some of these cultures don't even have a word for SIDS because it just doesn't happen. Not to say that infants don't tragically die from other causes, but the unexplained death during sleep hardly ever happens. And they almost exclusively bed share. And so the thing with bed sharing and I did this with my son, so I'm obviously biased. I'm a huge fan of bed sharing. With that said, we were very careful with the covers. We had minimum amount of pillows. We always had the covers folded down so they only reached his waist. He was always right next to me. I never drank when he was a baby, when he was sleeping in bed with us. I wasn't on any kind of medications that would make me drowsy. We had a giant bed, big king size bed. My husband was on the other side. So we were very cognizant about making sure that it was safe, and my son would breastfeed in bed. When the baby is touching the mother, our bodies help their bodies regulate breathing, temperature, blood pressure, so many things. Our bodies essentially teach their bodies how to be and to function. With that said, if bed sharing does sound like something you're interested in, I highly recommend you talking to your child's pediatrician, or if you're pregnant and you're deciding, you know, where you want baby to sleep, speak to your doctor, speak to a professional source, and ask them about bed sharing. You know, and ask them, say, if I'm not on any substances, if my husband and I don't drink at all, you know, when we are sharing a bed with our baby, if we're not on any medications, if we, you know, adhere to very specific guidelines for our bed, do you feel like this is safe? And have a discussion with them. But also know that they might just say, nope, it's not safe, because they don't want to have liability if anything does happen. But from my experience and from everybody I've talked to, mothers and partners are usually incredibly intuitive, and I never once, in years of bed sharing with my child, never once had a situation where I rolled on him. I mean, I was always aware of his little body. And I'm not at all saying that bed sharing is the way to go, that that's what you have to do. But for us, it was a really amazing option, and I felt safer having my baby right next to me, knowing, I mean, I would wake up a ton, especially when he was little, to make sure he was breathing and whatnot, especially when he was in a bassinet. I mean, I did not get any sleep, but when he was next to me and I could feel his heartbeat and I could feel his breath on my skin, it was so comforting, and I knew that I was always making sure that he was good. So talk to your pediatrician, tune into your own intuition. If me talking about bed sharing, if you're like, you are crazy, lady, I would never do that, that is totally fine. Do whatever you're most comfortable with. But yeah, so there's a lot of controversy there with bed sharing. Again, for my personal family, that's what worked best, but that might not feel good to you. But with that said, even if you don't bed share, one of the ways that you can help to prevent SIDS is to have the baby sleep in the same room as you, so you are more aware of their breathing and whatnot. So again, I hope this video didn't totally like freak you out. Hopefully these are pretty, you know, simple things that you can do, having them sleep on their back, not having anything that could get in their face in the area where they're sleeping. And yeah, you know, just being aware. You don't have to be paranoid, but being aware of the baby. And breastfeeding, that's another big thing that can really help if that's something that you choose to do. So if you have any other questions about SIDS or questions about pregnancy, childbirth, early motherhood, go ahead and email me at the email address below.